How to find mental health help from Cms.Gov. Chapter 1. How to find mental health services 1. The free booklet from Cms.Gov. A roadmap to behavioral health, a guide to using mental health at cms.gov/about-agency-information/omh/download/coverage-to-care-behavioral-roadmap.pdf. Emergency and crisis information. Need help now? Use these hotlines for help. If you need immediate help, please call your local emergency number or the mental health crisis line listed in your local phone book's government pages. National Suicide Prevention Lifeline. Suicide Prevention Lifeline.org. 1-800-273-TALK, 8255. TTY, 1-800-799-4889. 24-hour, toll-free, private suicide prevention hotline. Your call is routed to the nearest crisis center. SAMHSA Treatment Locator. Find treatment.samhsa.gov. SAMHSA Referral Helpline. 1-800-662-HELP, 4357. TTY, 1-800-487-4889. 24-hour free and private treatment referral and information about mental and/or substance disorders, prevention and recovery. Veterans Crisis Line. veteranscrisisline.net. 1-800-273-8255. TTY, 1-800-799-4889. Connects veterans in crisis with Qualified and Caring Department of Veterans Affairs, VA, responders. Uses private, free hotline, chat, or text. Also for families and friends of veterans. Disaster Distress Helpline. samhsa.gov/find-help/disaster-distress-helpline. 1-800-985-5990. Text Talk with us to 66746. If you experience emotional distress from natural or human-caused disasters, you can connect with the Disaster Distress Helpline. If you are in crisis, have an emergency, or life-threatening situation, call 9-1-1 or go to an emergency department. Your roadmap to health. Put your health first. Staying healthy is important for you and your family. Maintain a healthy lifestyle at home, at work, and in the community. Get your recommended health screenings and manage chronic conditions. Keep all of your health information in one place. Understand your health coverage. Check with your insurance plan or state Medicaid or CHIP program to see what services are covered. Be familiar with your costs, premiums, co-payments, deductibles, co-insurance. Know the difference between in-network and out-of-network. Know where to go for care. Use the emergency department for a life-threatening situation. Primary care is preferred when it's not an emergency. Know the difference between primary care and emergency care. Find a provider. Ask people you trust and/or do research on the internet. Check your plan's list of providers. If you're assigned a provider, contact your plan if you want to change. If you're enrolled in Medicaid or CHIP, contact your state Medicaid or CHIP program for help. Make an appointment. Mention if you're a new patient or have been there before. Give the name of your insurance plan and ask if they take your insurance. Tell them the name of the provider you want to see and why you want an appointment. Ask for days or times that work for you. Be prepared for your visit. Have your insurance card with you. Know your family health history and make a list of any medicines you take. Bring a list of questions and things to discuss and take notes during your visit. Bring someone with you to help if you need it. Decide if the provider is right for you. Did you feel comfortable with the provider you saw? Were you able to communicate with and understand your provider? Did you feel like you and your provider could make good decisions together? Remember, it is okay to change to a different provider. Chapter 2. How to find mental health services too. Next steps after your appointment. Follow your provider's instructions. Fill any prescriptions you were given and take them as directed. Schedule a follow-up visit if you need one. Review your explanation of benefits and pay your medical bills. Contact your provider, health plan, or the state Medicaid or CHIP agency with any questions. Visit go.cms.gov/C2C for more information. Understand your behavioral health. Learn about health insurance. Where to go for help and treatment. Find a behavioral health provider. Make an appointment with a behavioral health provider. Prepare for your appointment. Understand your behavioral health. Behavioral health is a key part of a person's overall health. It is just as important as physical health. It includes your emotional, psychological, and social well-being. Behavioral health conditions include mental and substance use disorders. Behavioral health conditions are common. People of all ages, genders, races, and ethnicities get these conditions. They happen with or without physical disabilities. If you have changes in your mood or behavior, or your alcohol or drug use causes problems, you may want to talk to your doctor or healthcare provider. Help is available. Recovery is possible. What is behavioral health care? Behavioral health care usually starts with a screening and includes treatment and recovery services and support. Screenings can be quick questions. They often are asked in a doctor's office, medical clinic, primary care clinic, community clinic, or, for youth, in a school-based clinic. This can help find disorders early and treat them before conditions get worse. If the screening finds a concern, a more detailed assessment may be done for a diagnosis. Mental disorders involve changes in thinking, mood, and/or behavior that may occur often, or less often. Substance use disorders occur when the use of alcohol and/or drugs, like opioids or tobacco, causes health problems or a disability. A person may not keep up with work, school, or home tasks. Co-occurring disorders usually means a person has both a mental and substance use disorder. Coexisting disorders usually means a person has both a behavioral and physical health condition. Treatments are services like therapy or counseling, medication, and supportive services. Supportive services can be helpful in getting a job, education, and housing. Some treatments may include staying in a hospital. It is different for each person. For many people, the best treatments are a mix of counseling, supportive services, and medication. Recovery services and supports help you manage your behavioral health conditions by providing social and emotional supports. They can also help with other concerns like finding a job, childcare, or affordable housing. The process of recovery is different for each person. Services and support may be by a provider, support group, community clinic, place of worship, or other community organization. Family members, friends, caregivers, and social networks may also be a part of recovery. Peers are people who had a similar behavioral health condition and are in recovery. They can be a great help and show you that recovery is possible. Warning: feeling and behaviors. Here are feelings and behaviors we all experience. Having one or more over a long period of time could be a warning sign. If you have one or more of these, see your doctor or a specialty provider. Eating or sleeping too much or too little. Pulling away from people and usual activities. Having low or no energy. Feeling irritable or annoyed more than usual, or all the time. Having unexplained aches and pains. Feeling helpless or hopeless. Feeling sad or anxious or empty. Loss of interest or pleasure in hobbies and activities. Feeling restless or having trouble sitting still. Difficulty concentrating, remembering, or making decisions. Smoking, drinking, or using drugs more than usual. Feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared. Having thoughts about death, suicide, or hurting yourself or others. Not being able to do daily tasks like taking care of your children or getting to work or school. Drinking 5 or more alcoholic drinks on one occasion for men, or 4 for women. Drinking an average of 15 or more alcoholic drinks per week for men, or 8 for women. Health Insurance Guide. Health insurance helps pay for healthcare services like office visits or counseling and prescription medication. Health insurance helps protect you financially if something unexpected happens. It is like insurance for your car or home. It also helps you pay for services to keep you healthy and deal with ongoing physical and mental health conditions. If you need help understanding how to enroll, visit healthcare.gov. Call the Marketplace call center at 1-800-318-2596, 1-800-Medicare. Contact your state Medicaid office. Most health plans must cover certain health benefits. This includes mental health and substance use services. Your exact benefits depend on your state and the plans. Most health plans generally cover these mental health and substance use services. Access to behavioral health providers like psychiatrists and psychologists, social workers, advanced practice registered nurses and counselors. Treatments like psychotherapy, counseling and medication. Inpatient services like a hospital or emergency room visit. Pre-existing conditions. Preventive services like alcohol and depression screenings are covered at no cost under most health insurance plans. Most health plans have similar rules for coverage of mental health and substance use disorder services as for physical health. This is called parity. It applies to co-payments, number of visits and pre-authorizations. Apply for health insurance steps. Choose health insurance. Pay premium, usually each month. Receive card. Choose primary care provider. Choose behavioral health provider. Make appointment. Prepare for appointment. Make follow-up appointment. Follow plan developed by you and your provider. If needed, fill prescriptions. If needed, update healthcare.gov with income and report life changes. Where to go for help and treatment. People get their behavioral health care in many places like a primary care provider, behavioral health provider, or the emergency department, ED or ER, in a hospital. There are big differences between visits to your provider and visits to the emergency department like cost, time you wait for care and follow-up. A visit to the emergency department will cost you more than an office visit. You may wait longer at a hospital to be seen and will have fewer choices about who you see. A primary care provider is usually who you see first. The provider may offer recommended screenings. The provider will keep your health records, help you manage your ongoing health needs and may also connect you to a behavioral health provider. Behavioral health providers are specially trained to work with people experiencing mental and substance use disorders. They work in hospitals, community mental health clinics, substance use treatment centers, primary care clinics, school-based health centers, college counseling centers and private practices. If you have an emergency or life-threatening situation, go to the emergency department or call 9-1-1. An important step to getting behavioral health care is finding a provider. There are different ways to do this. Primary care providers, like a doctor, nurse practitioner, or other health care provider, may be able to screen or treat many behavioral health problems. A primary care provider may also recommend or refer you to a behavioral health provider. You may need a referral for your health plan to pay for a visit. Check with your insurance company or call the behavioral health provider's office to be sure they accept your insurance and are an in-network provider. Sometimes insurance plans require a pre-authorization. This is a decision made by the insurance plan that a service, treatment, or prescription drug is medically necessary. Find health insurance. Call your general insurance company or state Medicaid and Children's Health Insurance Program, CHIP, program, look at their website, or check your phone book to find health providers in your network. Try healthcare.gov. Use the phone book or internet to search for particular needs, such as a provider who speaks a language other than English, can accommodate mobility challenges, is located near you, or works with specific populations, such as veterans. Recommendations from family, friends, and other sources. Ask family, friends, or another person in your community for a suggestion. A network is the facilities, providers, and suppliers your health insurer has an agreement with to provide you with healthcare services. Contact your insurance company to find out which providers are in network. These providers may also be called preferred providers or participating providers. If a provider is out of network, it might cost you more. Networks can change. Check with your provider each time you make an appointment. Find a behavioral health provider. There are different types of behavioral health providers. Ask your primary care provider for help deciding between types. Some examples are: psychiatrists diagnose mental and substance use disorders, prescribe and monitor medications, and may provide counseling and therapy. Psychiatric or mental health nurse practitioners are nurses trained to provide assessment, diagnosis, and therapy for mental or substance use disorders. They can also prescribe medication. These providers may be called Advanced Registered Nurse Practitioner, ARNP, Advanced Practice Registered Nurse, APRN, Advanced Practice Nurse, APN, Cert-EFED Nurse Practitioner, CNP, Cert-EFED Registered Nurse Practitioner, CRNP, or Licensed Nurse Practitioner, LNP. Clinical psychologists make diagnoses and provide counseling and therapy. Sometimes they can prescribe medications. Clinical social workers make diagnoses and provide counseling and therapy, case management, and advocacy. Social workers provide case management and help locate treatment services and other services to support recovery and healthy living. Counselors make diagnoses and provide counseling. They help with improving life skills and relationships. Peer specialists/recovery coaches are people who have experienced mental or substance use disorders and are in recovery. They can teach you about the health system, provide emotional and social support, and help your recovery. Peers often receive training and certification. Substance/addiction counselors advise people who have an alcohol or other substance use disorder. They provide treatment and support to help in your recovery. Look over the list of providers the doctor or hospital gave you. Look on the internet. Call the offices to see if they accept insurance and are taking new patients. Make an appointment with a behavioral health provider. After you choose a behavioral health provider, make an appointment. When you call to make an appointment, you should ask: are they accepting new patients? Do they accept your insurance? Always double check. If you need to, provide your member ID and /or group number. This can be found on your insurance card. What mental and substance use conditions does the provider treat? How soon can you get an appointment? Does the provider speak your language or have an interpreter? If you have limited mobility or other disabilities, is the office able to meet your needs? You might also want to consider: is the office close to your home or work? How would you get to the appointment? Is the office near public transportation? Will the appointment times work with your schedule? Now that you made an appointment, it is time to prepare. Here are the things you should take to your appointment: your insurance card, valid photo identification, any health history or medical records for yourself and family members, list of allergies, any medications, vitamins, or herbs you take. Bring them or make a list of their names, who prescribed them, and how much you take each day. List of other providers you see. Questions you want to ask your provider. Write them down and bring them with you. Make a list of the symptoms you have been experiencing, how long you've had them, and how they impact your life. Bring a notepad to write down any instructions. You may also want to bring along a family member or friend. Payment for a co-payment, if you have one. Chapter 3. How to find mental health services 3. Do you feel comfortable with this expert? You should feel you can work with, trust and be comfortable talking to your behavioral health provider. It is also important to share in decision-making about your treatment. Make sure you are comfortable with the treatment plan and it fits your needs. Talk about any concerns and questions you may have. Trusting and working with your provider will help you feel and stay better. Trust is built over time through repeat appointments, and open communication. After your FRST visit, think about: did you feel listened to? Did your provider use words you could understand? Pay attention to you. Speak in a way that made you comfortable? Did your provider clearly explain your treatment options and their benefits and risks? Did you talk about a treatment plan? Did you feel that you shared in this decision? If you were given a prescription, did your provider tell you when to take it and how much? Was the behavioral health provider respectful of your culture, opinions, values, and beliefs? Is this a place you'd feel comfortable going back to? If you asked for assistance, like an interpreter, translation, other form of written materials, or assistance related to your disability, was it provided? Do you have a follow-up plan? Can you contact your behavioral health provider or staff with questions? If you answered yes to most of these questions, then you may have found a behavioral health provider that's right for you. If you answered no to any of these questions, call the office and share your concerns. They may be easily fixed. You may also be able to see another provider. It is okay to ask for changes or to look for another provider. Remember, if you want to try a different provider, call your health plan or go to their website to make that change. Make sure you choose a provider who takes your coverage or you will pay more. Decide if the behavioral health provider is right for you. After your appointment, schedule any follow-up appointments before you leave. Routine appointments that fit your schedule can help build a trusted partnership with your provider. Follow the treatment plan that you and your behavioral health provider agree on. Read your explanation of benefits, EOB. An EOB is a summary of healthcare charges. Your insurance company sends this after you see a provider or get a service. It is not a bill. It is a record of your services and how much your provider is charging your insurance company. Be sure you are covered with the right plan. Plans and your health needs can change. Review your coverage options during each open enrollment to make sure your plan meets your needs. Tell your provider if your behavior or thoughts change. If you take medication, keep taking it as prescribed, even if you feel better. Talk to your provider about side effects or other concerns before you choose to stop taking your medication. You may need to change medications to find the one that works for you. Stay on the road to recovery, getting to recovery. Recovery is a process of change through which individuals improve their health and wellness, live a self-directed life and strive to reach their full potential. It involves overcoming or managing one's disease, or symptoms and making informed, healthy choices that support physical and emotional well-being, having a stable and safe place to live, meaningful daily activities and relationships and social networks that provide support. Recovery services and supports help you manage your behavioral health conditions by providing social and emotional supports and help with other related concerns, such as finding a job, finding childcare, or locating affordable housing. The process of recovery is different for each person. These services and supports may be provided by a doctor or other health provider, or by a support group, such as at a community clinic or a church. My to-do list, important health insurance info. Fill this out. Your name. Health plan name. Policy number. Group number. Health plan phone number. Primary care provider. Behavioral health provider. Diagnosis. Triggers for crisis. Pharmacy. Allergies. Emergency contact. Medications. Healthcare glossary website. healthcare.gov/glossary.